I'm frustrated. I'm frustrated because I always wondering why there is no caregivers as a sector for foreign workers to come in to work. Now, I know there are three reasons why we bring in foreign workers, because when it is dirty, difficult, or dangerous, we bring in foreign workers. So they have cleaning sector. Oh, that's dirty. Okay, we give the foreign workers lah. Okay, but that's not dangerous. Okay, it's dirty. Then we have jobs like service sector. Oh, we give it to foreigners because it's difficult. We don't want to do long hours. Then we have this sector called danger sector for manufacturing, plantation, construction. Oh, we give it to the foreign workers. But when it comes to caregiving for Malaysians, okay, it is actually covering all three sectors. It's dirty. If you clean backside, it's difficult because you have to carry old people, and sometimes with dementia, the whole night don't sleep. And it's dangerous for the caregivers. If they don't sleep for a few days, they can hurt themselves. It's dangerous for the health. So when it's dirty, difficult, and dangerous, all three together, we give it to who? Not foreigners. We give it to Malaysians. The government love you, ma. We give it to Malaysians. So when a lot of people ask me, Manto, when can we have a sector? Why don't you talk to the government? The government says we want to give it to the B40. No, because a lot of poor people don't have jobs. We give it to them a B40. Hello. B40 doesn't mean that they want to be a caregiver, They can still do many other jobs, They can go into cleaning, service, or manufacturing sector. Why must they go into caregiver? Go to cleaning is only dirty. Go to service is only difficult. Go to manufacturing is only dangerous. Okay, one out of three only. Why should I go to caregivers when it become dirty, difficult, and dangerous? In fact, those in B40, they also want to be doctors, lawyers, engineers, accountants. Some even wants to be politicians or even ministers because they say that making more money. And see, B40 also can think one, Just because they're poor doesn't mean they don't have dreams. Then someone asked me, what about those so many people out of jobs? Hello, out of jobs must work as a caregiver, meh? They can still do Grab, ma. Last time we got Mat Rempis. Now Mat Rempis are all Grab driver, Panda driver. Without them, we have no food delivery, So the things have changed, you see. Things have changed. They don't want to be caregiver. Why? Because it's dirty, difficult, and dangerous. Then people ask me, Manto, as Age Corp, National Association for Aged Care Operators, why don't you talk to the government? Hello, you think we didn't talk to the government? You think we didn't write to the government? My good brother in Penang, Santok Singh, he wrote to the government. No reply. He talked to the government. No reply. I went to see the ministers of human resources, of course. And when you see them, they tell me, oh, you have to do reports and statistics to show them that you need them. Hey, why you ask me to do reports and statistics? You have a whole department of statistics of Malaysia to do all the reports. You know what you need, ma. Why you ask me to do? Then when you talk to the human resource department, when we met them, actually a few of us went there, they told me, oh, this one is not my problem. You go to immigration. So in Putrajaya, we won't go to immigration next door already, ma. So we went to the immigration. Oh, this one is not my issue. This one you have to go back to human resource. Okay, human resource, just now I talked to a minister, then we talked to the pegawai lah. Oh, the pegawai said, oh, this one doesn't work like that. All sectors are open based on the requirement and request. So this one for care industry, you have to go back to Kementerian Pembangunan Wanita. So we went to Kementerian Pembangunan Wanita lah. And you know what they said to me? Oh, this one job we want to give it to our locals because it's difficult, dangerous, and dirty, ma. Want to give to locals, and locals, what do you want? Don't want to do. Okay. The previous government, they said I think it's one Aziza lah. She said we need 100,000 caregivers in Malaysia. 100,000 caregivers in Malaysia. Today, how many we have? There are so many university do courses. They also didn't get anybody. When usually locals also tak boleh pakai. Just recently, not so long ago, one renowned university did a 3-month program, a Penjana program for B40. So we got 50 students. So all the age corp members hire them lah. In your case, what happened? Within 2 weeks, all gone. Oh, wow, I think maybe 1 or 2 left only lah. Or cannot tahan lah, difficult lah, sick lah. So locals cannot do the job. Okay, so the bencana program for the B40 for caregivers become a bencana program for us. So what do you do now? What's happened next? Now the next thing I tell you what's going to happen. Now currently all the nursing homes comes under, well, old folks home basically comes under Jabatan Kebajikan. Technically, with the new ACTA, which is the Private Aged Healthcare Facilities and Services ACTA 802, this responsibility of deciding whether you have caregivers or from foreign country or not goes to, you know whom? KKM, Kementerian Kesihatan Malaysia. Okay, so now basically they are going to transfer to KKM, and who knows in KKM? My brother lah, KJ. So you are landed with this problem. The problem that is not solved at any level before. Now we have this problem. Now the question you ask me, I thought last time we got caregivers ma. Yes, but since 2009 there's no such sector anymore. So now the question is, who can make a decision? It's going to be KKM. If KKM says yes, if KJ say yes, you can basically bring in caregivers. Now we are not asking you for permanently having foreign caregivers. Actually, we need about 10 to 15 years to train up the number of caregivers to meet the requirement. Okay, Age Corp is prepared to help. We as operators, we are prepared to help. We just need 10 to 15 years, okay, of grace period to train the people up to do the job. Okay, so all they have to do is very simple. They just have to approve another sector for caregivers, for aged, okay, or for the care community. So I look at it this way. KJ did very well with the vaccination. From a MOSTI department managing a KKM department, it's like finance department managing sales, and bringing all the sales and get things done. So I believe KJ can get things done. So now the buck is back to KKM. KJ is a minister. I don't know until when, because I think next year is going to be election. So my friend, we are still frustrated. I am still frustrated because there is no such thing as a legal caregiver. Any caregivers you see in Malaysia, they are illegals. Even if they have permit, they have other permit, okay, like manufacturing permit, working as caregiver. They have a cleaner permit, working as caregiver. So they have a service restaurant man, working as caregiver. Why are we making things so complicated? Why? Tingkai? I hope this can be resolved. Back to you, KKM.